She is the oncologist from Tata Medical. Um, for the Women's Day occasion, it is a very special occasion for all of us, and oncology is a very big part of today's session. So, first of all, I wish all of you a very happy Women's Day. Girls, you should also wish me Happy Women's Day. After Anupriya's session, I guess you have energy. Happy Women's Day to all of us. Let's clap. Okay, for the next session, we have Dr. Subhashri Raut. She is an oncologist from Tata Medical Center. She is there with us. I request ma'am, please come on the dais. Please give a round of applause for her. I also call CA Vidhi Chandak on the stage. She will be moderating the session for us. I also call CA Anita Toshniwal on the stage. Oncology, when it comes to our mind, it's a big topic nowadays because we all are becoming very health conscious. And as women, we know there are certain parts of cancers which are affecting, say, most of us in some way or the other. So we have Dr. Subhashri Raut, who is a consultant in Department of Gynecology Oncology at Tata Medical Center, Kolkata. She holds MBBS degrees along with MS in obstetrics and gynecology and has further specialized in cancer care with DRNB in gynecology oncology. She is also an FAMS and holds the prestigious ESGO certification in gynecology oncology, reflecting her advanced training and international standards of expertise in the field. Dr. Raut is dedicated to the diagnosis, treatment, and prevention of cancers affecting women, including cervical, ovarian, and uterine cancers. With her strong academic background and clinical experience, she is committed to promoting women's health through early detection awareness and advanced oncology care. At Medical Center, she plays an important role in providing comprehensive and compassionate care to patients while also contributing to awareness initiatives on women's health and cancer prevention. So, welcome ma'am. Thank you for taking out time for us. And she will be helping us and she'll be throwing light on the gynecology oncology. And we have CA Vidhi Chandak, who is going to moderate the session for us. I request CA Komal Bajaj Bhautika to come and facilitate Dr. Subhashri Raut. Since she is not there, Alice, please come on the stage to felicitate Dr. Subhashri Raut. Please, can we have a round of applause? Alice, can you please stay back after felicitating ma'am? Alice, I would also like you to felicitate our moderator, CA Vidhi Chandak. Vidhi ji. कंजूसी मत करिए, अभी पावरफुल सेशन था. Now I hand over the session to CA Vidhi Chandak. Thank you, Alice.
Good afternoon, everyone. First of all, I thank ICAI to give me this privilege to moderate the session on cancer awareness. So, in my opinion, every woman in this room has a story, maybe of its own, her own, or maybe of mother, daughter, sister, or a dear friend. When we think about that story, we feel heavy and some fear comes. So we are here to help to find out if there is any cancer, how to prevent it, or how to know it beforehand so that we can get the diagnosis earliest. Because proactive care is always better than the treatment. See, as a chartered accountant, we are the masters of risk assessment and long-term planning for our clients. We ensure that every audit is thorough and every balance sheet is perfect. But today, we are here to talk about the one asset we cannot replace, that is our health. In a profession defined by deadlines and busy seasons, our whole wellness is often ignored. Today, we are making it a primary focus because an investment in awareness is the one that yields the highest return. मैं अपने घर फैमिली की एक बात बताती हूँ. मेरी एक आंट को ब्रेस्ट कैंसर हुआ था, पर 0 स्टेज में डायग्नोस हुआ था. तो उनका न कीमो हुआ न रेडिएशन हुआ, जस्ट ए सर्जरी एंड मेडिसिन फॉर 10 years. So that's the easiest way to tackle with cancer. So awareness is very important. अभी अपने जो वर्ड नाउ कर रखे हैं न्यू ऑर्बिट फॉर वुमेन, उसका मैंने एक इस सेशन से लिंक करके बोला है, लिखा है नोटिस, ऑब्जर्व एंड विल पावर. नोटिस एनी चेंज इन योर बॉडी, ऑब्जर्व रेगुलरली थ्रू सेल्फ एग्जामिनेशन, विल पावर टू सीक मेडिकल एडवाइस इमीडिएटली. बिकॉज व्हाट हैपन, जो मैंने फील किया है कि लोग को पता भी चलता है, डाउट भी होता है, तो डॉक्टर के पास जाने से घबराते हैं कि डॉक्टर इसको कैंसर न बोल दे तो मेरा तो ट्रीटमेंट बहुत डिफ़िकल्ट हो जाएगा. हमारे साथ मौजूद है एक्सपर्ट डॉक्टर, जो हमें बताएंगी कि इस बिजी लाइफस्टाइल के बीच भी हम अपने हेल्थ को कैसे मेंटेन कर सकते हैं, कैसे स्क्रीनिंग एंड प्रिवेंशन, एंड मोस्ट इम्पॉर्टेंटली वो हमारे सारे क्वेश्चंस का आंसर भी देगी. So without further delay, let's begin our journey towards better health together. And I invite Dr. Subhashi Rao to guide us.
Thank you for the invitation. Actually, oncology is very scary, isn't it? Is anybody heard about that recent announcement by Government of India regarding the HPV vaccination for cervical cancer prevention? Okay. Recently, last month, it was an announcement from the Government of India that every 14-year girl, now it has been included in the national immunization schedule. So every girl who is 14 years, not completed 15, they will be provided with free dose of HPV vaccination. So what is that? So आज I am a gynae oncology, so I will start with cervical cancer. Cervical cancer is the most common leading cause of cancer and death in India. Now, actually, it was initially the cervical cancer was the main cause of death and suffering in women, but nowadays breast cancer is the most common cancer. So how to prevent it? The good thing about the cervical cancer is that the cause is known. The cause is one of the virus that is called human papilloma virus, and it gives around 20 to 30 years of screening period so that we can prevent and treat the cancer. So what is the main thing? So first thing, we can prevent it by vaccinating all the girls between 9 to 14 years, but it can be given up to the age of 26 years. So please promote if any girls nearby or in our family, so they should be vaccinated before the age of 14 years. If not, then quite and good if we give it between the age of 26 years. And second thing, every woman after the age of 25 to 30, just to do one screening test that is called HPV test. So it is a test which is done every 5 years. If it is negative, then we are quite sure that cervical cancer will not happen, because that virus is the cause of cancer in 97% of cases. So only one virus, one screening, if it is negative, we are quite sure that it is not going to happen. And just it is a screening test up to the age of 65. So every lady should be screened with HPV screening test. If it is not possible, another test, equivalent test is also available, that is called pap smear. It is one test done everywhere, but if you are doing it, it has to be done every 3 years. And second thing, if it happens, usually cervical cancer is quite preventable if it is detected in early stage. If it is detected in stage 1, then in that case only surgery is sufficient. There is no need of any radiation post-surgery. So it is better to prevent it because it gives around 20 to 30 years of screening period so that we can screen it, treat it, and we can prevent the complications. Even though it is stage as second stage or third stage, during the patient reach the hospital, then also it is treated with curative intent. With radiation we treat it and the success rate is very good. So what are some symptoms? If somebody is having any form of bleeding after the menopause, then that is a sign. She must visit the hospital just to screen whether the cervix and uterus is normal. So don't ignore any post-menopausal bleeding. If it is there, then and there it has to be screened or it has to be evaluated. 90% cases it will come negative, but in 10% cases it will come as suspicious or malignant. In that case, we have to treat that. And suppose somebody, some lady after the age of 30 or 40 is having some intermenstrual bleeding. That means bleeding between the menstruation cycles. If that is irregular and frequent, then in that case also it has to be examined by one gynecologist. And suppose somebody is having some spotting or some bleeding after the relationship, then that is also a warning sign. That has also should be treated, or it should be at least evaluated by some lady doctor or by some gynecologist. Okay. And coming to the like, if suppose somebody is having some white discharge, if that is normal, not foul smelling, then that is okay. If it is associated with some foul smell, then also please visit the gynecologist once. So never, always try to, like, if there is any symptoms other than normal bleeding or any form of discharge, then always it has to be evaluated. Coming to the breast cancer, every lady after the age of 30 should examine her breast. That is called self-breast examination every 1 month. If somebody is having some lump or some changes in the size of the breast or any nipple retraction, that means the nipple is getting retracted inwards, or any skin changes or any form of abnormality which was not there, then also it should be screened, because nowadays initially it was a norm that cancer it happens after the age of 60 years. But now we are getting many patients before the age of 50 even. So it should not be neglected. Even in 20s and 30s also, we are seeing some patients diagnosed with breast cancer or cervical cancer. So if any changes, it should be addressed. And second thing, every lady after the age of 40 years should have one mammography by some radiologist. What is mammography? It is one form of X-ray. It is just 5 minutes procedure, so it has to be done. If it is normal, then nothing to do, or else it should be done at least annually once. And some patients, like, they are more genetically prone because some defect is there in the gene. If suppose somebody is having breast cancer, then very much likelihood that in the family it can be genetically carried out. So in that cases, two cancer it is more prone for, that is breast and ovary, because ovarian cancer and breast cancer, they are more related. Simultaneously, like if somebody is having uterine cancer, then more chance of colon cancer, because colon cancer and uterine cancer, they are more related. So if there is some person in the first degree relatives, somebody is having some form of cancer, then better to meet one genetic counselor so that she can be screened. If there is any genetic defect, then usually we do the same genetic defect testing in the first degree relatives. So there are many cases where we can detect the cancer like before it happens. Suppose somebody is having ovarian cancer and she is genetically prone to develop the cancer, then in the siblings and in the daughters we are testing the same mutation. If it is there, then we are just removing the ovaries, and that will prevent her cancer in her livelihood. Okay. So always any abnormality, any abnormal symptoms, we should visit the doctor, and even you are not visiting, self-breast examination, that is a must. And any form of abnormal vaginal discharge or abnormal bleeding apart from menstruation, that should be evaluated. Any question? Yes, please. Mammography actually after the age of 40, it should be routine. If somebody in the family is having any form of breast cancer or ovarian cancer, in that case, we start the screening after the age of 30. Mammography is an X-ray like thing, but in like women less than 40 years, in that case, if we do the ultrasound of breast, that is also good enough. And with ultrasound, there is no radiation exposure, and if there is any abnormality, then only we do the mammography, or else ultrasound breast is sufficient.
Frequently you suggest this test for a woman?
Like if somebody is like some family history, then we advise for the genetic testing. If it is so, then we screen every 6 months. Or else, if there is a family history and she is prone for cancer, in that case we screen every 6 months, or else we can screen annually.
Thank you.
Any other question, anything you want to ask? Yes, genetic test is a blood test. That is actually various types of genes are getting evaluated in that particular one test. So there are some common genes related to particular cancer. There are some specific genes related to ovarian cancer, some specific genes related to breast cancer, some specific to colon cancer, some specific to uterine cancer. If any type of gene is detected and that is related to a particular cancer, then we do the screening at a regular frequent interval. It is not specific that only one gene is causing all the cancers. Different cancers, different genes are actually responsible. No, if somebody is affected, then only we first screen the patient. Somebody is suppose diagnosed with some form of cancer, then we do the genetic test in the patient itself. If it is positive, then we screen the family members. Or else there is no point, because unnecessary why to do one test. If somebody is affected, then particularly we just do the risk evaluation, how much is the chance that first degree relatives are getting affected, then only we do the specific genetic test, not the entire panel is required. Yes, please.
Ma'am, is there any way by which we prevent cancer itself from affecting or completely?
No, actually thing is that from skin to each and every organ can get cancer. So for different cancer, different treatment options are there, and different screening methods are there. Yes, for cervical cancer we can prevent it up to 97 to 98% because we know what is the cause.
Exactly what is the cause for this cancer, ma'am?
Sorry?
Ma'am, exactly what is the cause, major
One
cause?
cause is that human papilloma virus. Okay, every woman after their first relationship, they get that virus. But it usually clears off by itself. If it persists, then in 20 to 30 years, it can lead to abnormal changes in the cervix, and there is abnormal growth in the cells, then it can lead to cancer. So what can we do after the age of 25? Just every 5 yearly we have to do one test, HPV test or pap smear. If it is there, then we can get the treatment then and there itself, so that it will not be in the future. If it can be prevented or treated from that period, then it will not happen. But apart from that, 97%, 2-3% are not related to this virus, that we cannot prevent it. And for likely like breast cancer has very good prognosis if it is detected in stage 1. Just a cell breast examination, if there is any doubt, if we just visit once and it can be detected and treated, they have very good prognosis. Even the 5-year survival rate is more than 20 years for breast cancer. For cervical cancer as well, even in stage 2 or 3 of cervical cancer, if that is getting treated, then the success rate is very high, around 60 to 70% in stage 2 and 3.
Doctor, there is one question.
Yes, please.
You told you should go to the doctor if there is any doubt in the breast, if you feel.
Definitely.
Then which normally people have tendency to go to the gynecologist.
No, no, not necessary. If you go to general surgeon also, that is also good. If some changes or some form of lump or some nipple retraction, any form of discharge, particularly if it is blood tinged or bloody discharge, then if you once visit them, then they will just do one examination. They will advise if it is less than 40 years or 45 years, they advise for ultrasound breast, or else if more than 50 years, one mammography. From there, they will give one score. So if the score is 1 and 2, that is called Baird score. If that is 1 and 2, then we can observe her at frequent interval. If it is 4 and 5, then they will advise for one FNAC or biopsy from that lump. Then accordingly we can proceed. But thing is that if it is stage 1, it is very good prognosis.
But doctor, what I have felt in my life, that general surgeon or gynecologist, I should not say, sometimes not able to find out what is there.
Because if suppose actually at young age the breast is dense, so in that case small amount, if it is very small, less than 2 centimeter or 1 centimeter, it is difficult to find out. So that's why we tell after age of 40 we can do one routine mammography in the routine checkup. If there is any suspicious, we can.
So only mammography or mammo with sono on the same day?
If breast is dense, then they will advise both. If breast is not that dense, then mammography will be sufficient.
Mammography once a year, people are really afraid of getting it done because बहुत सारे views इन सब सुनते रहते हैं कि भाई इससे और कुछ होने का चांस होता है. लोगों को fear भी है कि painful होता है.
No,
so,
actually mammography is not painful.
I know, but people say
it is just
painful.
X-ray like thing. Somebody has to stand, just one photograph will be taken, that's all. It is not painful.
People have fear in general that
and
when
it will just take 5 to 10 minutes.
And because what I have heard that both done together can find out the big lumps and the small.
Yes, actually if it is something is suspicious in the mammography, at the same sitting they will advise for one ultrasound breast, and both combining both they will give the report.
Any question from the audience? Our work is like we are sitting for 10 hours, 12 hours in a desk. So does continuous sitting and working have any effect on the cancer, on the chances of getting cancer early?
Like what is the risk factor?
Like, we don't, like no, when we start working, सुबह ध्यान ही नहीं रहता टाइम का, बस वो बैठे काम ही करे 4-5 घंटा निकल के, we don't move also. So उससे कैसा ऐसा सुनते हैं कि भाई अगर immobility है तो ज़्यादा जल्दी कैंसर होने का चांस होता है, कोई भी कैंसर, not only breast.
No, actually nowadays the food habit, everything has been changed. Environment, everything is changed. Physical activity is less, and the food which we are getting, like all are adulterated with some artificial colors, preservatives, chemicals. If something we are taking regular basis so unhealthy, then that's why cancer incidences are increasing.
Is there any food which according to you if we consume can help us कि हम कैंसर को थोड़ा सा डिले कर सकते हैं, कट तो नहीं हो सकता?
Scientifically, evidence based, there is no such food we can reduce the cancer.
Just healthy food.
Scientifically there is nothing, but yes, if we eat more those who are high in antioxidants like fruits, vegetables, and less fat, like saturated fat, all deep fried food, if you can avoid, then there will be less weight gain, because obesity is a strong risk factor for uterine cancer.
Obesity.
Okay, obesity.
Okay.
So in that case, the chance of getting cancer in comparison to a normal lady is more than like 2.5 to 3 times more. So if somebody is having diabetes, obesity, high level of cholesterol, hypertension, she is very much like 3 times more prone for uterus cancer in comparison to normal lady. And somebody is having regular constipation, so she is more prone for colon cancer in comparison to normal population. There are some risk factors, but yes, obesity is a known risk factor for cancer. So if we eat healthy, then we will not be obese. In that case, we can prevent it.
Yeah, and not being obese, we also have another option of doing exercise.
Yes, yes,
So I just want to
definitely.
understand what's a better option for women after 35. It's cardio or it's strength training, so that we can avoid these diseases as much as possible.
Actually, we advise for brisk exercise like brisk walking for 40 minutes a day. In that case, like the muscle strength, body metabolism, and the regulation of all the like insulin resistance, everything is a good, like we can say that 40 minutes a day brisk walking, it is very much helpful. Even those who are diagnosed with cancer, suppose they are awaiting surgery or chemotherapy or radiotherapy, then also it say the same. If they do the muscle strength, muscle mass, that will like adequate enough, the protein intake should be high so that they can fight the cancer better.
Does hard drink and smoking affect getting
Actually,
cancer?
scientifically, there is no such documentation that hard drink or soft drink, because yes, alcohol, if it is taken in a adequate amount, that is not that bad, but it has to be adequate amount. But smoking, it is directly associated with lung cancer and some form of like oral cavity cancer. It is a known risk factor for that, smoking.
What about hair color?
Hair color, scientifically not yet proven. No, scientifically there is no document, there is no evidence.
Ma'am, there are few chemicals that have become very popular nowadays. SLS and other chemicals that they say that is a part of your, any kind of cosmetics we are using. So is it going to affect or is it going to result in cancer?
No, exactly. So for actually directly say yes or no, it has to be evidence based. That means a large population has to be tested for that. We make two groups. One group they take the chemical and the other it is not. So ethically also that is not correct to conduct such type of trial. So as of now there is no such evidence that I can say it is yes, it is carcinogenic and it is not.
Ma'am, because nowadays what has been happening that they have been promoting cosmetics on different levels, stating that this is SLS free, this does not have phytogens. There are certain chemicals that they are ruling out that this is something which is causing all kind of hormonal disruptions as well as they are carcinogens. So shall we go for that marketing gimmicks or shall we not?
No, actually, if we don't use, that is better. But if there is no option left, then at least choose a better brand in that case.
Collagen, glutathione, everything is coming.
No, no.
So
I am not qualified enough to
For that.
comment about that.
Thank you.
Does breastfeeding for a longer time reduces the risk of
Breastfeeding, yes. No,
breast cancer?
breastfeeding is a preventive, very much preventive for breast cancer. It is a known fact. Breastfeeding reduces breast cancer.
डॉक्टर आज के टाइम में शादी बच्चे पढ़ रहे हैं, जॉब कर रहे हैं, शादियां लेट कर रहे हैं, बच्चे लेट हो रहे हैं, बहुत लेट, मतलब शादियां होते होते अगर 28-30 इयर्स की हो जा रही फीमेल्स की भी। सो मैंने कहीं पढ़ा था कि अगर शादी जल्दी होते हैं, बच्चे जल्दी होते हैं तो ब्रेस्ट कैंसर का चांसेस कम होता है।
Yes. Usually what happens, usually maximum breast cancer are hormone positive. The hormone we get from the ovaries. In that case, suppose somebody is pregnant. During that 9 months, the ovary will not ovulate. So there is no injury to the ovary. So yes, that is one protective factor. So yes, pregnancy, breastfeeding also, usually women, they don't get menses. So in that case, there is less chance of injury to the ovary. That is a protective factor. Like pregnancy, breastfeeding, protective factor for breast cancer. Because that time ovary remains dormant. It is not that functional. So yes, if something is not functioning, then chance of injury is less. In that case, it adds to the benefit side.
एक और मिथ है जो बहुत लोग पूछते रहते हैं कि बायोप्सी कराएंगे तो अगर कैंसर हुआ तो स्प्रेड हो जाएगा, तुरंत सर्जरी करानी चाहिए, ऐसा कुछ?
Yes, actually biopsy, suppose there are some cancers, like we have to take the biopsy to get the diagnosis. For example, cervical cancer, we have to take the biopsy for the diagnosis and it will not spread. It has been proven. Uterine cancer, we have to take the biopsy from the uterine cavity. to prove that it is cancer so that we can treat. It will not spread. Cervical cancer, uterine cancer, breast cancer, if we take the biopsy, it will not spread. But suppose ovarian cancer, there is a very highly suspicion that it will come as malignant, because as per the ultrasound report, if it is very much high likely that it can be a cancer. So in that case, we don't take the biopsy, because if it is, it will upstage. If we rupture the ovarian mass, it will upstage. That time what we do, we have to remove the ovary. Then and there we send to the pathologist for the examination. They will tell us in 45 to 50 minutes that it is cancer or not. If it is not, then we stop the procedure. If they say it as cancer, then same sitting, we do the rest of the surgery. In ovarian cancer, if ovary is the only mass, then we don't take the biopsy because it will upstage. Suppose already we see in the scan that already it has been spread, then we take the biopsy from the other side, not from the ovary. But for uterine, cervical, breast, we have to take the biopsy to just know that what type of cancer is it. First of all, is it a cancer or not? If it is, then what type and what is the grade, what is the biology, that we have to know, and it will not spread.
Ma'am, what's the difference between FNAC and core biopsy?
FNAC, just a small amount of tissue is taken. In biopsy, good chunk of tissue is taken. Actually, pathologists, what they do, first they see under the microscope. From FNAC and biopsy, they can do. Both can be done if it is FNAC or biopsy. But there are some tests like immunohistochemistry, exact characterization of the tumor, exact status like it is high grade, it is low grade, what is the receptor status. For that, they need some amount of tissue. So in that case, we have to take one biopsy. Suppose somebody is having some suspicious breast mass. In that case, we have to take the biopsy because we have to exactly characterize the tumor. In that case, suppose in some cases, suppose there is some cervical cancer, uterine cancer, any form of abdominal cancer, and the diagnosis is proven. Suppose apart from that, there is one lung mass or neck mass. In that case, we do the FNAC because we have to know just it is positive or negative. But for the primary diagnosis, we take the biopsy.
Core biopsy. So doctor, normally when we go to the other doctors and they doubt, they always advise FNAC. Only
FNAC
oncologists advise core biopsy. There is the challenge.
For the diagnosis, biopsy is much better than FNAC. Because in the same tissue, we can know what is the exact tumor biology. Yes, please. Ideal age is 9 to 14 years. Up to 26 years, even up to 45 years it can be given, but if it is given before the first intercourse, then in that case it is much more effective. It is effective like more than 95%. If suppose after the relationship it has been given, already exposure is there. So in that case, if we vaccinate, then it will reduce, but like 70%, 75%, not up to the extent it is if it would have been given before the first relationship. And suppose we are giving the vaccination, then also we should start screening after the 25 or 30 years, because it can prevent up to 97%. Rest 2 to 3% also, that has to be, it should not be missed. It is not that somebody is vaccinated means she will not be screened. Definitely she has to be screened. But if it is given before the age of 26, it is better. If we are giving before the age of 14, then we give two doses. If it is more than 14 years up to 45 years, then we give 3 doses. Even it has been proven that 1 dose of vaccine also very much effective, more than 90%. It has been already proven. Because one trial has been started from India by Shankar Narayan. It was a blessing in disguise. Some form of due to some ethical clearance, it didn't get approval. So first dose has been given. Then the trial stopped because some rumors are there, it is not safe. So Government of India stopped that, it is not going to be given further. So in that case, after 10 years of follow-up, those who have been vaccinated with even a single dose, it has been seen that it is also quite good enough to prevent the cervical cancer, because those group of population, they didn't get the cervical cancer, like 97% patient, they didn't get the cervical cancer. So even single dose is quite enough. Recently, it has been going on as per WHO World Health Organization. They are mostly trying to evaluate the evidence, and mostly in future it will be a single dose instead of 2 or 3. Hi. Yes, please. So, pardon?
Endometric thickness, I believe. Yeah.
Endometrial thickness. Usually, suppose a lady had attended menopause. After that, ideally, it should be less than 4 millimeter after menopause. If it is more than 4 millimeter, definitely we should do one biopsy. And it is a OPD procedure. No need to get admitted. No need to go under anesthesia. It is a OPD procedure. It will hardly take 2 to 3 minutes. Postmenopausal lady, more than 4 millimeter. If menses, one menstruating lady, if it is less than 12, then it is normal. If it is more than 12, then we have to, in the first go, we don't do the biopsy, but we have to keep her under follow-up. If it is persistently thickened, like nowadays you must have been listening, like polycystic ovarian syndrome is so common. In that case, it is slightly higher chances that endometrial thickness will be more. Because menstruations, it doesn't happen at a regular interval. Monthly, it is not happening. So in that case, thickness is more. If it is persistently more than 12 millimeter, then we can think of one biopsy. But in the first sitting, never. We will just follow her up, like what is the thickness trend. Then we can evaluate if it is somebody is having more than 40, heavy bleeding, thickness is more than 12. Then we do the biopsy. No, early menopause, it doesn't increase. Late menopause, it increases the chance of endometrial cancer. But early menopause, if somebody is having, then we usually advise for hormone replacement therapy. You have been heard of. In that case, we just rule out some form, like there is no family history, no personal history of breast cancer. In that case, we can provide hormone therapy up to the age of 55, provided there are, like, liver function is normal. If somebody is having migraine or some neurological problem, in that case, we don't advise for that. But early menopause, estrogen, what is coming out of ovary, if it stops its secretion from the ovary, then we call it as menopause. In that case, usually estrogen is very much protective for bone and skin and heart. So in that case, if suppose somebody is getting her menopause before the age of 40, in that case, we definitely treat her with additional hormone up to the age of 50 at least. But early menopause is not a cause of cancer. In that case, we have to give frequently calcium, because bone strength and heart, mechanism, usually it is very much protective for, you have been listening, some male, they are getting heart attacks before the age of 50, but usually in females it doesn't happen because of this estrogen. So if somebody is having menopause, early menopause, then we should give hormone therapy, provided it is safe for her.
Any other question?
As per Indian data, it is 51 years in India. Like, they usually, one menopausal society is there. Every frequent interval, they just latest, it is 51 years for Indian women.
Ma'am, I have one more question. Nowadays, we have been listening a lot about cyst, fibroids, chocolate cyst, endomycosis, all these issues with the ovary and the uterus. Ma'am, does this also can convert into cancer or any kind of tumor?
Like fibroid, what you said, like if we just do an ultrasound of all the women, then in 40 to 50% it will be there. Fibroid is not cancer. Very rarely, like in 1,000 cases, out of 1,000, one can convert to cancer, but usually fibroid uterus is not cancerous, and that is not a reason to get the uterus out, to get operated. And endometriotic cyst, like chocolate cyst, what we call, usually that is also very common. If suppose size is less, then that is not going to harm. If size is more, then ideally, if we advise for cystectomy, just to remove the cyst, yes. But if you compare chocolate cyst is slightly more towards cancer if you compare to the normal lady. In long run, if it is not getting treated or if it is there, slightly more chance of some specific type of cancer. And polycystic ovary as such, it will not cause cancer, but the hormone estrogen, it gradually increases in the body, and increased estrogen, slightly more chances toward the uterine cancer. In the long run, not immediate effect.
Any more questions? Thank you, doctor. So what we have learned today and we should follow. पहली बात कि जो भी यहाँ सीखा, at least 5 जन को बताओ घर जाके. Maybe friend, colleagues or family. So that the matter spreads. We are here just that the awareness spread होए. Breast cancer, uterus cancer, cervical cancer and so self-examination is very important. Once in a month, not less than, not more than that. Otherwise अपने को ये feel होता है वो normal लगने लग जाता है. तो once in a month से ज़्यादा self-examination नहीं करना. Am I right, doctor?
Change much.
And screening जिसकी भी due है mammogram या pap smear में वो please अपना schedule कर लो and motivate others to get it done. It's very important early detection. अपने बोलते हैं रिटर्न लगने के पहले जितना चेंज करना है कर लो, लगने के बाद अपने हाथ में नहीं है. So please, accordingly, we should also take care of our health. So, in my opinion, we are the backbone of our family, pillars of our family. So we should first take care of our health. अपने अपनी हेल्थ की बात नहीं करते हैं, सबकी दूसरे की हेल्थ की बात करते हैं, फैमिली में बच्चों की, हस्बैंड की, सबकी. एंड इतना बिजी लाइफ है सबका कि अपना अपना छूट जाता है. सो आई जस्ट रिक्वेस्ट एवरीवन दैट अपने हेल्थ पे बहुत ध्यान रखो, स्पेशली वुमेन के लिए दोनों कैंसर बहुत इंपॉर्टेंट है. इसके लिए जो भी अपने को स्क्रीनिंग करना है एग्जाम, उस पर प्लीज़ अपना टाइम दीजिए. सो स्टे हेल्दी, स्टे इन्फॉर्म, स्टे एम्पावर्ड. हैप्पी इंटरनेशनल वुमेन्स डे.
So ladies, I will agree with Vidhi ji. In today's time, हमारी generations की जो women हैं, उनके लिए सबसे ज़्यादा we are like robots because we are the women who are handling family also and our careers also. पहले वाली women mostly उन लोगों को career oriented नहीं होती थी और future वाले women है they are very clear कि हाँ हमें हमारे career पे focus करना है and family की responsibility दोनों जन मिल के ले रहे हैं. So what I feel कि this generation women are really like robots. So in इतनी भागदौड़ की लाइफ में what we miss taking care of our health. So like statutory audit, हम लोग एक हेल्थ चेकअप का ऑडिट हमारी लाइफ के अंदर फिक्स कर लेते हैं बिकॉज इफ़ वी टेक केयर ऑफ आवर हेल्थ तभी एज वी सेड वी आर द पिलर्स ऑफ आवर फैमिली वी विल बी एबल टू टेक केयर ऑफ आवर फैमिली. As we come to the end of this session, enlightening session by Dr. Subhashri Roth, for such an insightful talk, it is my privilege to extend a heartfelt thank you to you, ma'am. The way you explained such an important and sensitive topic with so much clarity and compassion has truly left us a deep impact on all of us. And so many questions from all the audience over here clearly shows that yes, we are really concerned for our health also. So thank you. Cancer is not just about cure, it's not just a medical challenge, but it's also an awareness. Early detection and timely action can save lives. On behalf of everyone present here, I express my sincere gratitude to you, ma'am, for this valuable session. The strongest weapon against cancer is not fear, but it's awareness. So please let's spread this awareness among all our female colleagues and professionals. Thank you very much. Now we will take a break for 30 minutes and after that, grab your coffee, refresh yourself because we are going to enter into our star session by Squadron Leader Shivangi Singh, the pride of India and country's first women. Can we have that AV play on the screen? Ladies, I am very excited. Hope you all are. a symbol of courage and determination. After a break of 30 minutes, you all have to go to cafeteria ground floor. Thank you very much. See you again.